Tuesdays, and we try to go live on Tuesdays at 7 p.m. Eastern, unless I'm traveling or have something else going on. So I'm here to help you with what are your burning hormone questions. Usually I get a lot of questions on these lives about perimenopause, menopause. I got a lot of PCOS questions. I got a lot of teens with acne. I'm here to answer whatever questions I can. I'm a traditionally trained OB-GYN. I am a medical doctor, not your doctor though. So I really can't give medical advice, but I'm hoping that I can be here to help you with any of the questions. Now, if you guys aren't following me on YouTube, head on over to Tara Scott MD, Hormone Guru. And if you're on YouTube and you're not following me on TikTok, Hormone Guru, Instagram, Hormone Guru MD. Also, we have a free newsletter that you want to subscribe to. So click the link in the bio. I think the link is updated. I'm not exactly sure. Check out my link tree. So I am going to see for the next half an hour, 40 minutes, how many questions I can get through. I have my assistant here. You may hear his voice reading me questions on YouTube. If any questions come up on YouTube, and we're hoping that we can get this recorded and uploaded there for future reference. So thank you for all you who are joining. Let me know where you're joining from. Tell me, is it as cold as it is in Northeastern Ohio? Because I woke up this morning and it was real feels -8. So I'm not really a fan of the cold weather. All right, Gennard H., where to start for balancing out estrogen dominance? That is a great question. I will tell you what we do is we like to find out, are you estrogen dominant because you make a lot of estrogen or because you don't get rid of estrogen? So that's a really important part of the equation. Now, if you don't get rid of it, how do you find out? Usually you have to find out through doing something called a dried urine test, which not everybody can afford to do or has access to it. So when we talk about estrogen detoxification, there's 3 phases. The first 2 are in the liver. The third is your gut. So what are some things that can help your estrogen detoxification? The first phase is helped by something called DIM, or eating broccoli, kale, cabbage, or some dark berries. That's something that can help the first phase of your estrogen detoxification. The second phase is helped by B vitamins and magnesium. And the third phase, which is your gut, is helped by fiber or calcium D-glucarate. So those are some things that will help. Most people are pretty well tolerated. And then what I really suggest is decreasing your alcohol, watching your sugar and processed food, and trying to cut out plastics in your environment also, because those can also increase your estrogen. All right. McGlorious, hello. If you have a 42-year-old in Perry who's still cycling regular, would you put on progesterone and estrogen? I'm a doc. Thank you for joining, McGlorious, and that's a great question. Generally, what I was always taught is if you are still having a cycle, you don't need estrogen. Now, that's not always true, but I think it's very safe to use progesterone. Let's just say you don't have access to check hormones. It's very safe to give progesterone, micronized progesterone. We start with 100 milligrams. We start in the luteal phase on day 15. Like, you're talking about a 42-year-old. If they're not trying to get pregnant, you can even start it at before ovulation on day 10. They may or may not need estradiol, but we don't routinely start it for someone who's still cycling regularly. So thank you for joining in. Hi from Michigan. Where in Michigan, Danielle? Let me know. Cindy, Charleston, South Carolina. I still want to try to go there at some point. You look like you're glowing. Barefoot on the grass. I got my hair done today. I'm sad to say that I have to get the color done almost every 4 weeks. So thank you. And yes, Barefoot, I had to get Invisalign. So I just got those a couple weeks ago. So that's why I might sound a little bit different. I did a post on this that I all of a sudden woke up and saw that my teeth shifted. And I did a literature search to find that, lo and behold, it's influenced by menopause. That estrogen and the drop in estrogen makes your ligaments and your gums lax and your teeth shifted. And I had braces as an adult. So yes, sad to say, but it's supposed to only be 6 months. My teeth were so crowded that I couldn't floss between them. And I had gone years without cavities and then ended up with a couple. So that's why I have mine. Cookie, I'm on BHRT. I'd like to add testosterone too for libido. How do I go about asking my doctor for this? So Cookie, and for those of you wondering about testosterone, the guidelines from the Endocrine Society and the North American Menopause Society are that testosterone is indicated for postmenopausal people with low libido. And remember that our traditional colleagues don't do any lab testing at all. They may or may not test your testosterone, and they might try it if you say you have low libido. However, if you're premenopausal, Someone who's integrative and functional like me, a hormone specialist, has no problem giving it to somebody with low testosterone premenopausally and indicated, but there seems to be a hesitation for some providers for people who are not postmenopausal. So how do you go about asking? I would tell them you have low libido. I would tell them you have vaginal pain with intercourse. And that may be one of the reasons to try to get it. But I am a fan of prescribing testosterone for those that need it. I have seen great results with my patients. Got a question on YouTube.
Lola Luna says, hey.
Hey, Lola. Oh, no question? Oh, just hey. Thank you for tuning in, Lola Luna. Okay, Laughter Wins. Love the name. Laughter Wins. Postmenopausal. How does hormones impact your blood pressure? Okay, great question. If you actually look at the textbook, estrogen lowers blood pressure. So it's the difference in having too much estrogen can cause high blood pressure, and having low estrogen can cause you to have abnormal blood pressure. If you have low estrogen and have high blood pressure, giving estrogen can help it. In addition, low progesterone and the lack of progesterone can cause blood pressure to be high because progesterone helps your blood pressure. Jessica, thanks for joining. Thank you guys for all who are tuning in. Remember that there is a little bit of a delay on the questions, so I'm trying to get through as much as I can. McGlorious, we tried the E2 and it changed her life. Okay, she didn't love the P4. I'm wondering if that had to do with the dosage. I don't recommend giving estrogen without progesterone. Grosse Pointe, that's not far from Ann Arbor, right? Grosse Pointe supposed to be really, oh, it's right on the lake. It's really nice. Thank you for tuning in, Danielle. Natalija, oh, I love that name. Dawson, got off birth control 4 years ago and having constant acne since. Feels like I've tried it all. Okay, I don't know how old you are, Natalija, but I will tell you acne is not always high testosterone. It can be high estrogen, low progesterone, estrogen dominance. It can be gut issues, bacterial overgrowth in the gut. It can also be food sensitivities. So maybe try just for 3 to 4 weeks eliminating your gluten and dairy and maybe inflammatory foods like processed foods, and see if you can find someone to check your hormones. What can help you? You could try some zinc. You could try evening primrose oil, not evening primrose oil, fish oil, according to the American Academy of Dermatology, could also help, and vitamin D. Glorious, brain fog on, libido back, no more VMS. Just want to know risk if we use HRT. Well, the risk of using HRT, again, Glorious, if you're giving estrogen and not progesterone in a perimenopausal woman, the risks are going to be probably a little bit different. You have to worry about the endometrial lining. Hopefully she's producing some progesterone, but I don't know if I would still supplement without it, because if there becomes any hyperplasia or any issues, you may be liable. But risks, I think, there are frequently people in perimenopause who do need it, so I don't think it's a problem. Check out the North American Menopause Society. Also, there's a lot of new publications on safety of estrogen, really. Okay, how to lose weight with no detectable estradiol. Giselle, that is a very difficult question. There are some studies out of the University of Colorado where they looked at weight and estrogen and menopause, and they did define that, yes, at menopause you do gain weight, most likely in the abdomen, and that your metabolic rate, which means how many calories you burn just sitting there, goes down. And in those patients, in those studies, they tried to have them exercise to see if it helped, and it didn't. But when they gave those patients estrogen, it did improve. So how to do it if you don't want to take estrogen. Think about your carb macros and your protein. We recommend women eat at least 80 grams of protein a day unless you have some kind of kidney issue. And really be conscious of your carbs at each sitting. We recommend 20 grams of carbs at each sitting at the most. So think about that. Allie, I love breakthrough bleeding. I love breakthrough bleeding and migraines on birth control. Skipping is my favorite. Oh, yes. I think there's a little sarcasm there because I'm sure you don't love it. Breakthrough bleeding and migraines make me think it's probably not a good match for you. I know when I started my birth control for painful periods and endometriosis at the time, I needed to go through 7 different types of birth control before I found one that I didn't have breakthrough bleeding. And that, to me, should have been a sign of what I didn't know then, is that I have a problem with estrogen metabolism. Julie, why the micronized progesterone upsets my stomach but not the cream? Well, oral micronized progesterone is kind of hard on the stomach and it's not absorbed very well. So when you're taking it as a cream, you're bypassing the stomach, and that's probably why. 209-77288. Perimenopause, still have a period. Should I start HRT? When people are in perimenopause and they're still having periods, we usually have no problem starting progesterone. Estrogen is going to depend on a lot of other factors, how close your periods are, and that kind of thing. Barefoot on the grass, thank you for sharing the live. Michelle, 55, hysterectomy, lichen sclerosis, no libido. I use hormone patches. Should I take testosterone too? Michelle, for all of our patients that have no uterus, or even if they have a uterus and they're taking estrogen, we don't ever give it without progesterone. You have an estrogen and progesterone receptor in every cell of your body, namely your breast and your brain. So we don't give one estrogen that is a stimulatory hormone without the balancing hormone of progesterone. I know it's controversial. That's my opinion. I've actually done a lot of videos on why I give progesterone after hysterectomy. The data shows that a progestin increases the risk of breast cancer, and you shouldn't give a progestin if someone doesn't have a uterus. But it doesn't say that about progesterone. Several studies do show that there's an increased risk of breast cancer with using estrogen only. That's a little bit controversial though, because there was one that showed there wasn't, but the ones with the higher numbers of patients did show that. But yes, in the past, Michelle, lichen sclerosis did respond to testosterone, both topical and also systemic. So I think that's a good idea for you. But I would also personally add the progesterone. Lala, does caffeine affect hormones? That's a really great question. Too much caffeine can stimulate the cortisol. Cortisol in excess can affect the way your body processes estrogen. So yes and no. 1 to 2 cups in the morning in moderation is fine. Too much can also affect your hormones, specifically cortisol, which also affects your estrogen. Hannah, taking DIM to lower estrogen, but it's making my cycle go from 27 to 22 days. Should I stop? That's really interesting. It might be that estrogen's not the problem, and maybe the first phase of estrogen detoxification is not your issue. I don't know, Hannah, what your symptoms were that made you try the DIM. So maybe it's the problem that you need the progesterone instead. And I don't know how old you are too. Styles' wife, I just lost your question. Oh, here. My doctor only tested estradiol and hydroxyprogesterone. Are there other progesterone I could test for? Styles' wife, that's a great question. The hydroxyprogesterone is more of an adrenal progesterone. We test for progesterone, and we prefer the LC-MS assay. So not hydroxyprogesterone. That's the wrong progesterone. It's just progesterone. And then it might say LC-MS after that. And we want to make sure if you're still cycling, you're testing it after ovulation around day 19, 20, or 21. Vienna, how long until a testosterone cream works? For any hormone, it really takes 8 to 12 weeks to really assess a dosage. Hormones work through a receptor. So what does that mean? You have to use a receptor to get into a cell. So think of if you're playing musical chairs and you don't have very many people playing, you're going to take some chairs away. So you're going to have less chairs. But as more people come, you're going to need to bring more chairs in. So that's like those receptors when your hormones are low will shut down. So there's a period of needing to augment and induce opening more receptors. So it really takes 12 weeks for us to assess a hormone dose. Oh, Allie, yes, sarcasm. Well, I'm sorry you're going through that. It sounds like you have an estrogen problem, and hopefully you'll be able to find someone that can help you with that. And thank you for the gifter badge. Thank you for sharing the live, A. Conley. Let's see. Does progesterone increase cortisol? Kira 09, very good question. If you look at the steroidogenic cascade, which I'm sure you're not really looking at it, you'll see cholesterol, pregnenolone, progesterone, and then one little thing over is cortisol. They actually, though, exist in different components of the adrenal gland. So it's not like it goes over to increase it. It is a remote precursor, but there's several steps. Progesterone really is a precursor to aldosterone. So kind of a different segment of the adrenal gland, but it's peripherally related. But that's a great question, Kira. Bonita, I'm 53 and losing my hair. I'm only taking estrogen. What else can I take for my hair loss? Bonita, I see that in patients, and that's one of the reasons. Again, think about it. You're taking estrogen, but not the balancing hormone, progesterone. Just because you don't have a uterus doesn't mean you've had your breast removed, you have your brain removed, you have your muscle in your bones. They exist in tandem in our bodies, so that's why we always like to give you both. The misnomer is the synthetic version causes problems, so when you don't have a uterus, we don't like to give it. So for you, Benita, if you were my patient, I would definitely want to put you on progesterone. Sometimes that alone helps solve the problem. I would also check your androgens, your testosterone, your free and total, your SHBG, and your DHEA and DHES. Those could all be sources of hair loss when you have low androgens. Nicole, tests show my estradiol, progesterone, and testosterone are all low. Any suggestions on how to help? Well, Nicole, the suggestions are going to be like, do you have ovaries? Do you not have ovaries? Are you cycling? Are you not cycling? What part of the cycle were those all hormones tested in? So our suggestions would be based on that. Now, not knowing that about any, what can I do to help you? If you're a young person, seed cycling, to you not. If you're a person older like me that's in menopause, I would talk to you about hormone replacement therapy. But if you didn't want to do that, I would have you make sure you're getting 7 to 8 hours of sleep. I would have you cut out processed food, plastics out of your environment, and also concentrate on whole foods, lots of vegetables. I would have you limit your alcohol, and I would have you really identify your stress. Okay, Summertime Love, you're a 40-year-old, but I don't have a question from you, Summertime Love. Okay, Styles' wife, after my periods, I get very fatigued and anxiety, but my doctor won't test other hormones. Okay, Styles' wife. Well, here's the thing. I can tell you I'm a traditionally trained OB-GYN, and we get no training on how to test your hormones unless you're trying to get pregnant. That's it. No training. So if you want to have your doctor, your OB-GYN, or your family doctor test your hormones, you might meet with resistance, right? But that would be like if I went into Pizza Hut and said, hey, I really want spanakopita. And they said, we're Pizza Hut, we don't have Greek food. And I said, but I really want spanakopita. Can't you just make me spanakopita? You have flour, you have spinach. They don't know how to do it. They're a Pizza Hut. Okay, so going to your doctor and asking them to check your hormones. You might have a doctor that really wants to help you and really wants to check your hormones. So they order a bunch of things. They order the wrong things. They test them at the wrong time. Then they tell you they're normal. So then you're still at the same position that you were. So my advice is to find someone who is trained or to kind of think about some of those non-hormonal things that can help you. I'm working on a few things to try to help you guys who can't get it. Okay, Maria, progesterone only vaginally for 2 years in perimenopause with no periods. My estradiol levels are super low. Only vaginally. So Maria, that's another way for people to take it who don't tolerate. So thank you for reminding me about that, that there are some people that take it that way. It's not really systemic, but it can be an option. Time for estradiol, no periods in 2 years, then yes, you may need that. Hannah Shelley, pellet hormones are the best things I've found that works for a long time for a period of time. Great. I'm so glad that you are finding something to help you. Let's see. Okay. Got a question from YouTube?
Helen M.
Helen M.
had uterus and cervix polyps removed. Ever since I gained 10 kilos in a few months, no diet change. I'm type 1 diabetic, so I know what I eat and how much insulin I inject, so it's not food. I'm 43.
So no ovaries? Ovaries have been removed? Or just uterus. So it becomes difficult if you have your uterus removed and your ovaries remain to know what's going on with your hormones. So we still check blood tests in those patients. It could be estrogen dominant. Sounds like if you're managing your carbs, that's great. And that is the first thing you need to do. And if you're diabetic, you're well versed on how to manage that. Sounds like it's a hormone problem. Now, the reason you had the hysterectomy was an estrogen dominance related thing. So that makes me think you still have that same problem even when you remove your uterus. So that would be my recommendation.
Monica Lopez says, hi, and does doing HRT cause hair loss?
Hi, Monica. So I can tell you that in patients that took synthetic HRT, oral estrogen and synthetic progestins, yes, it has been shown to cause hair loss. But I can tell you in my patients who take transdermal estradiol, which is bioidentical, and bioidentical progesterone, I really haven't seen the hair loss unless they have low androgens also, which would be low DHEA and low testosterone. But that means it's not from taking the hormones, it's from the lack of other hormones. But great question.
Oh, as a follow-up, Helen M. said polyps removed, not any organ.
Polyps removed. Okay, so a common cause of polyps is also estrogen dominance. So that seems to be something that you're going to need to have checked out. Since you said kilos, I'm guessing that you're in the UK or in Australia, so it might be challenging to get someone to check your hormones. So refer back to my comments about estrogen dominance. Yes.
Arlene says, can I put estradiol on my face? I have POI in the skin under my eyes are a little bit thin. Age 33.
Helen?
Arlene.
Arlene. So I hope that you're getting the help that you need, because of the challenging situation. I have lots of POI patients in my practice, and androgens have to be addressed. I'm just wondering, has anyone measured your testosterone, your DHEA, your DHEAS? But back to your original question, I actually prefer estriol for the skin. There are more estriol receptors in the skin than estradiol, so that would be my treatment of choice, and I have patients who use that. But great question. Mary Ruiz, how to lower cortisol if you were taking spironolactone for hormonal acne, stubborn hormonal belly. Gosh, if I had everybody has a different successful therapy for lowering cortisol. But the problem is you have to find what works for you. And there's not really one supplement. We like to use phosphatidylserine, but that's not always the one. That doesn't really lower cortisol, it just protects your body from high cortisol. So meditation, yoga, breath work, those are the things that have been studied that are really good. But if you're someone who just hates yoga, it's not going to work for you. So it's going to have to be something that you like to do, whether it's breathing. If you think breathing is stupid, that's not going to work for you either. So it's going to have to be downtime. It's going to have to be sitting with your dog or your pet or something that you enjoy that relaxes you.
LV says, I'm suffering with heavy periods and anemia for 4 years after getting off birth control. Everything came out normal on my ultrasound. Should I be taking DIM or DHEA?
So DHEA isn't directly related to that. That's a separate independent thing, which I think you should be assessed for. DIM could be helpful, but tranexamic acid is a prescription for something that helps the bleeding. If you're anemic, you need to have some help. I would also want to know what your estrogen and progesterone levels are. I'd want to know, how old was she? Did she say? She didn't say how she was? No. I mean, Vitex, depending on how old you are, chasteberry could be helpful, but in those patients, a lot of my patients need micronized progesterone. All right, Nicole, not cycling for over a year, and I'm 53, so that sounds like that's menopause. Roberta Mentier 2, no ovaries, hypothyroid, 74 years old, losing lots of hair, help. So wanting to make sure first that a full thyroid is being investigated, TSH, free T3, free T4, reverse T3, and thyroid antibodies. Wanting to look into the gut issues also. Wanting to look into your androgens, your DHEA, your testosterone, and also if you're 74, cortisol, something that we would look at as well. Periods lasting 9 to 10 days, some spotting between cycles, sometimes possible causes. Genard H. When I hear a long period, I always think estrogen. Estrogen dominance, low progesterone. Spotting in between makes me think you have a problem with too much estrogen. Yes.
LV has a follow-up. She says that she's 47-year-old and her doctor won't check hormones because she says, I'm so young, too young.
47. You guys, you know that like last month, at least half of my new patients were under 30. So I'm so happy that that crowd is looking and being proactive. We see women in the 40s all the time and check hormones, and I have been doing this for over 20 years. So I can tell you that it can be done because I've actually been doing it in my practice. So how, going back to the question you might not have been on when I talked about how your doctor most of the time wants to help you, they just are not equipped with the knowledge. So sometimes they don't want to check hormones because they don't know when to check them, how to interpret them, and then what if you have an abnormal finding and they can't help you. So my biggest advice to you guys who are listening, how do you find a hormone provider? Well, you can vet them now, right? So you can look at a directory on www.m.com. In the right-hand corner, it says find a provider. You put in your zip code, look for someone who's fellowship trained and board certified. A4M is the American Academy of Anti-Aging and Regenerative Medicine. That's where I train. That's who I teach for. They are trained in hormones. you could look at the DutchTest.com, their provider directory. Those are people who run the Dutch test. You could look at IFM.org. Those are functional medicine providers, but they are not always trained specifically in hormones. They might be trained in Lyme. They might be trained in mold. So look at their website, vet them, look at their social media and see what they post on. See if they have extra training. Ask them if they have it. You can also look for a certified menopause practitioner. They have training in hormones. They won't be scared to use them in you, but they might not necessarily do any hormone testing. That's a traditionally trained doctor. I have all those certifications.
So LV says, thank you so much for answering my questions. And Monica had a follow-up. Once again, sorry if I missed it, but what combination of HRT again do you recommend? I see the doctor on Thursday, so bioidentical is better than synthetic. Thank you. I already had my hormones tested.
Yes, I love estradiol through the skin as a patch. There's also an estradiol gel. Those are FDA approved, commercially available that you can use your insurance for. Micronized progesterone is the bioidentical progesterone that we use. And so most of our patients can start on hormone therapy with some coverage of their insurance that are bioidentical. Okay. What can I do about night sweats? Barry, 1, 2, 3, 4. There's so many questions that follow up with that, Barry. So is that every day of the cycle? If you're someone that menstruates, is it right before your cycle? If it's before your cycle, before your period comes, I think of it being low progesterone. If it's during your period, day 5, 6, 7, I think of it being low estrogen. It could be cortisol. It could be blood sugar. It could be low testosterone. There's a lot of reasons for that. Now, what can you take for that? Some people think that fish oil can really help that. Some people also think a rhubarb supplement can help that as well. Black cohosh may also be helpful for you. Erica, have you ever seen hormonal issues cause GI issues? Yes, there's a lot that's been recently published about the changes in the microbiome with menopause. They had patients that had premature ovarian insufficiency, so primary ovarian failure. They checked their microbiome. They changed almost to that similar to male microbiome. And then when they gave them hormone therapy, they saw that it changed back. Some of my patients, their primary complaints have been GI issues. And when we replace their hormones, those GI issues get better. So yes, Erica, you're right. There is a connection there. Miss D. Lane, I'm 50 and on 0.75 estradiol gel and 200 of progesterone. My doctor bumped it up and recently I feel terrible. Misty, that is kind of a high estrogen dose. Now, people don't know. I think that's why you're feeling terrible, Misty. I don't know if it's the progesterone that's making you feel terrible. That is a very high estrogen dose, and especially if you're doing 2 pumps. I don't know how many pumps you're doing. Are you having breast tenderness? Are you having weight gain? Are you having headaches? It may not be the progesterone, but the estrogen. Oh, Angela Italiano, thank you for sharing the live. An endocrinologist could be helpful for hormone testing. An endocrinologist that's trained and comfortable in female hormones could very well be helpful. In my area, the endocrinologists aren't trained in hormones and they don't check female hormones. So I guess it depends on what region you're in. Chat City Nicole, can your hormones be the cause of why you're unable to lose belly fat even if you are regular? Yes, that could be an estrogen thing. That could be a cortisol thing. Even if you're still having regular periods, you're right. Polycymide, menopause, no symptoms. Do I need HRT? Great question. So the Menopause Society says that between 50 and 60 or within 10 years of menopause, there are more benefits for you taking risks than harm. They're indicated for vasomotor hot flashes, for vaginal dryness, painful intercourse, low libido, prevention of bone health, or if you have early menopause. So there are other less common symptoms. My sister went through menopause, didn't have any of those symptoms. So she asked me, should I take hormone therapy? I went through the whole risk, benefits, and alternatives with her, and she said, okay, well, I noticed that I'm insulin resistant now. I've gained weight. I'm going to try some hormones. And guess what? She said, I didn't realize I had such bad joint aches, and now they're gone. I wasn't sleeping because the joint aches were so bad. So she didn't have the typical symptoms, but she did have a benefit. So someone needs to sit down with you, hopefully, and tell you about all the risks, benefits, and alternatives. Samantha Morgan, I had my tubes removed during C-section with twins. My cycle is so heavy now. I feel terrible. Reason? Well, first of all, hi to another twin mama. I had twins as well. So you had your tubes removed. Did you have your tubes removed for contraception? I'm also wondering if you spontaneously conceived your twins, if you had some infertility before. I have a lot of questions, or maybe you were on birth control pills before your pregnancy and now you're not on birth control pills. That often is the culprit. So whatever the birth control pills were masking now is able to come out. So polysomnine anxiety, to me, feels like it's that high estrogen dose. So that's my thing. I would actually maybe think about doing the estrogen every other day and the progesterone every day. That half-life of that estrogen is 18 hours. So that means that when you put it on the next day, 24 hours later, you still have half as much circulating as the day before, and it can accumulate. Lisa, 46-year-old, hysterectomy, has ovaries, no gallbladder. Progesterone helps, but still struggling. Lisa, you're 46. It could be androgens. It could be testosterone, DHEA. I know you have your ovaries, but you would really benefit from checking hormones. Guys, I am working on something behind the scenes. It's probably going to be a long time, but I hear the same thing over and over. How can you get someone to check your hormones? What can you do? How can you check things? So I'm trying to put something together for you guys. So those of you that can't find help can help themselves. Lisa, I think it's one of those other hormones. I don't know if you're having honey hot flashes or anything else. Hannah Shelley, they're very conservative with treatment. Find a provider that deals with HRT directly. Hannah, I agree. Giselle, I was placed on Progesterone and now I have very low estrogen, almost none detectable. So that, Giselle, is something that's not available in the United States. So I'm not sure. That's a type of progestin, but that's a synthetic progestin. That is not, as far as I know, bioidentical. Stacer Macer, do you have optimal hormone levels while in HRT in menopause? Funny you should ask. I just printed recently published articles, hot off the press, but I have not read it yet. And this is by Louise Newsome. If you guys don't know her, she is a doctor in the UK who's a menopause specialist. And she's done some research on those levels. So I cannot say, I just read a blurb on it. So I think there's some new data that's saying maybe the levels that we were using were not as high as they should be. We were saying like 50 to 80 of estradiol, and progesterone levels can be all over the place. But I think she published some great data that said for bone protection and brain protection, they should be much higher. So check in with me next week. Catch me live. Maybe I'll be able to answer that question, and I'll probably have made a video on that. Okay, so I'm trying to get through a few of these messages before my battery dies. Do estradiol reconnect your muscles and tissues? Show enough. Good to see you on here again. Estrogen has to do with your musculoskeletal system, and low estrogen causes more inflammation. And also, as I mentioned with my teeth moving, laxity, that's why people get shoulder issues. So there is a connection there. Karen, 39, low testosterone, high prolactin, second blood test normal, all symptoms, and low libido. I'd want to do a little bit more digging as to find out why your testosterone is low. I'd want to look at your adrenal function, your DHEA, your DHEAS. I'd want to look at the rest of your hormones too. High prolactin, and then a second one normal, I'm assuming was fasting. I'd want to look at your thyroid as well. Leslie Bell, my doctor tested me in 2018. I'm on estradiol and norethindrone, but it won't test me to check levels. Well, estradiol sounds like it's a bioidentical estrogen, but you're on a synthetic progestin. I'm not a fan of that, but hopefully you're feeling okay. Letty Watson, 51, ablation 2 years ago. How will I know if I'm menopause? Exactly. Your definition of menopause is going to be different. If you've had an ablation and you don't bleed, you can't go by the 1 year without a period. You have to have an FSH tested 4 months apart over 40. Ideally with an estradiol, that's low. That's how we make it. Sherry Cole Sterling, is there any natural HRT? So when you say natural HRT, I'm not sure what you mean by that. If you mean natural is bioidentical, bioidentical means that it's chemically, structurally the same as what our bodies have. Think about a diabetic patient. They need insulin. We don't go draw insulin from a human, process it, and give them someone else's insulin. We go to a lab, we take a compound from a plant, and we chemically synthesize it to be structurally the same as insulin, and then we give it to diabetics that way. We've done the same with female hormones. So there are those. As far as plants that are, I mean, you know, some people do the seed cycling, and they can have some help with that when they're younger, but in menopause, there's not as much. Angie, 38 years with 13-day long periods. That is not normal. Your hormones aren't normal. They're not tested at the right time. They're probably testing them on day 3 instead of day 21. You should not have a 13-day long period, Angie. I'm sorry you're going through this. I think you need a second opinion. Under 30, what's going on? What percentage? Oh, poli-sci, I was just saying that I had a lot of my new patients that were under 30. So there was a question on YouTube that says their doctor said they were 47 and too young to check hormone. And I was saying, I've checked them in my teens. I've checked it in my teen patients. There's no, too young to check hormones is probably before puberty. Once you have your menstrual cycle, you're not too young to check hormones. We can do it all day long. Tina B, what can you do if DHEA is abnormal? I'm getting tested. My estradiol is 600 after hysterectomy. That's high, Tina. It sounds like you maybe could have an ovarian cyst or you have a problem with your estrogen. Hopefully someone's going to give you some progesterone to balance that out. Lisa Galaviz, 57, had a hysterectomy in 2018. My doctor does not want to help. I'm so sorry. Listen, I talked early about finding a provider on www.a4m.com. And actually, if you search my videos on TikTok, I have a whole playlist about finding a provider. And I've done videos on how to find a provider. It's so much easier now to vet someone via social media. All right, I'm trying to get through a couple. It looks like I am not going to be able to get through all these because my battery is on low. I'm on progesterone, estrogen patch, and I've been spotting in between my periods, 48-year-old. So Galena, I'm wanting to know, first of all, you're stopping the progesterone and the estrogen when you have a period. That's the way we have it with our patients. We try to have them cycle and we have them stop it on their periods because that's what naturally your body does. The hormones are lower when you're on your period. That could contribute to spotting if you're not on the right dosing.
Amy says, my gyno is against hormone replacement, stated the longer you have estrogen, the higher the risks are. Ugh. I'm 54 and having so many symptoms.
Well, if your gyno is against hormone therapy, they don't have to take it themselves. But does your gyno get to make the decision about what you do? The number one killer in women is heart disease, not breast cancer. Your risk of breast cancer is 1 in 8, just being a woman, your lifetime risk. If you choose to take hormone therapy, you are adding the risk of 1 out of 1,000. So that's 0.01%. The older you get, I think I saw it's a little bit higher than 1 in 8 for when you're over 50. But that's all it adds, 1 in 1,000, so 0.01%. That's your increased risk. But what is your risk of heart disease? What is your risk of osteoporosis? The death rate 2 years after a hip fracture is higher than 10 years after breast cancer. So your gyno, unfortunately, hasn't had the training. And so they have a preconceived notion. So I really suggest for you a second opinion.
Love Your Life says, watery prolonged periods. 2 fibroids of 1 centimeter each in ultrasound. GYN recommended HRT. I don't want that. How can I cure naturally?
Wow, that's a really tough question. And I have done some videos on fibroids and it involves a hormone evaluation, but you could try taking N-acetylcysteine. You could try taking some other things that kind of prevent, but you got to see how your estrogen detoxification is, clean up your diet, take your plastics out. And that may be a way to start. But it's a pretty complicated question to give you a quick answer to. Lizzie6695 says, what tests are needed to determine if testosterone levels are normal or not? Total testosterone, free testosterone, SHBG, DHEA, unconjugated, and DHEAS. 2 minutes. Okay. Let's see. I'm 53. I haven't had my period. Hold on. I just lost the question now. Haven't had my period in 6 weeks. My doctor says I'm in perimenopause. So yes, once you're now officially in perimenopause. And you know, the average age is 52, so you're past that now. It's hard to say like what's going to happen with you. And as far as, is this the beginning of the end or is it going to go on? Mia, 1974, a combi patch is good because it's transdermal estrogen. It's a patch, but it's a synthetic progestin. So I'm not a fan. It? Okay. Sorry that I didn't get through all the questions. Thank you so much for tuning in. For those of you that want to watch and rewatch what you missed, we'll be uploading it to YouTube. Make sure you give me a follow there. If you're not following me here, give me a follow and subscribe to our free newsletter. And as long as I can, I'll be here Tuesdays at 7 p.m. Eastern to try to get through as many questions as I can. Thank you so much for hanging out with me today, and have a great day.